Hello, good afternoon, everyone. Hopefully you all had a delicious lunch and are ready to hear an interesting topic today. We're talking about non-toxic IV therapies for oncology patients. Thank you for the introduction, Frank. I'm just going to give you a few more words about myself before we get started. I graduated from Southwest College in Naturopathic Medicine in 2002. I started Synergy Naturopathic Medicine in 2003, and I've been practicing at the same location in Monrovia ever since then. Prior to that, I have been a licensed physical therapist, graduating from the University of Buffalo in 1993. So between my allopathic background and my naturopathic background, I decided to come up with the name Synergy, since it kind of combines the best of both worlds together, and that's kind of how I practice at my clinic. I'm not sure if everyone knows what naturopathic doctors are. We're only licensed in about 20 states right now, but hopefully one day that'll change and we'll be licensed in all states in this country. But we are primary care doctors who use the best of both worlds. So both traditional medical therapies, standard allopathic medicine, combined with natural healing methods. At Synergy, we focus on the whole person in treating our oncology patients holistically, not just treating one of their symptoms or treating a particular disorder, but the whole person. So we feel if you have cancer, whether it's me or somebody else, you should always have a naturopathic doctor on your team. Just some background here. As a doctor working with oncology patients, we have certain goals in mind when our patients come in to see us. And our primary goals, most of them are actually going through standard conventional therapies. So we want to try to improve their survival rates and length of survival by strengthening not only their immune system, but supporting other bodily systems as well. We want to enhance whatever standard conventional therapy they're going through and address risk factors that might be associated with poorer outcomes. Of course, we also want to improve their quality of life by mitigating or decreasing the side effects associated with the cancer progression and most standard cancer therapies. Even though we use certain IV therapies in our practice that do create oxidative damage to cancer cells, we like to use the term cytotoxic to describe the body's ability to fight cancer by creating a more cytotoxic environment and less hospitable environment for the cancer in the body. We don't use or prescribe substances that are directly cytotoxic to cancer cells. That is chemotherapy, and that is reserved for the oncologist. So what I hope to do today is take you through kind of from first diagnosis through different treatment options, and after the treatment's over, what to do next from an IV therapy perspective. So I'm sure every one of you has either known somebody, maybe personally a friend or a family member, that has been diagnosed with cancer. And I think the first thing that goes through anybody's mind is fear, uncertainty, not knowing where to turn. And you feel a sense of urgency, too, to make a decision. And unfortunately, sometimes those decisions are made too rapidly and the wrong decision is made. So we're here to help our patients, understand what are their options out there besides, conventional therapies. And if conventional therapy is the most appropriate therapy, how can we support them as they're going through that? I think most conventional therapies you are familiar with include surgery, chemo, radiation, and there's more targeted biological therapies out there right now as well. After traditional therapy is completed, most patients ask, what's next? So we are going to go through what can we do to prevent reoccurrence. If the cancer has progressed, what other therapies are out there that we can try? And unfortunately, if the traditional medical world has nothing else to offer, what can us naturopathic doctors offer from a palliative standpoint? I thought this was a good slide to summarize the current state of oncology therapies. It says the bad news is we found a mess. The good news is we have weapons of mass destruction. And yes, we do, right? I mean, these therapies are sometimes needed, but they create a lot of collateral side effects associated with them. Okay, so I'm not sure if everyone's familiar with the common side effects of traditional therapies, but I'm going to briefly touch on those, and then I'm going to focus the rest of my talk on how IVs can help to mitigate these symptoms. So with surgery, we have to think of a couple things. Pain and inflammation, certainly infections are big complications of surgeries. Loss of function and constipation. No doubt the person's going to be on pain meds, and a lot of times they cannot have a bowel movement after they have surgery. Chemotherapy, gastrointestinal disorders. Chemotherapy targets the most rapidly dividing cells in the body, and unfortunately some of those cells are in the gastrointestinal system, which means the patient's having diarrhea, nausea, vomiting, lack of absorption. Blood disorders such as low red counts, low weight counts, fatigue and cognitive changes. If anybody has personally had chemo or knows somebody who's had chemo brain is real and it's not fun. Nervous system effects such as paresthesias and pain, and other things like hair loss, loss of function, things like that. Some big side effects are radiation, are really localized to that site of radiation, including a burn to that area, which does create pain and swelling. People get very fatigued when they're going through radiation. They can experience some hair loss as well, and other localized effects specific to the area being treated. For instance, say if somebody had radiation to the oral cavity, they might not have the ability to produce as much saliva as they used to, and that would make that very hard for them to eat. Okay, so this gets into the meat of the presentation here. How can we use IV therapies to benefit our oncology patients, and why should every patient who is undergoing traditional therapies or maybe has decided to forego traditional therapies, why should they consider getting IVs? Again, we come back to the gastrointestinal system. The gastrointestinal system cells are, very rapidly dividing and are targeted by a lot of these therapies. So these patients are not able to absorb and digest nutrients like they would otherwise. And honestly, most of my patients, even if they're not oncology patients, have very poor digestion to start with. So getting an IV in them is the best way to get those nutrients in them, get those nutrients in at higher doses, and have a therapeutic effect much quicker than taking something orally. We can also use certain therapies to enhance the effects of chemo and radiation in cancer cells. Yes, we can actually do IV therapies right along with those treatments. I know in the past that vitamin C, most oncologists have told their patients not to take, vitamin C therapies, especially IVs, when they're going through chemo and radiation, but research has found that it can actually enhance the cytotoxic effects on the cancer cells while protecting our own cells. Certainly, decreasing side effects associated with chemo and radiation and speeding recovery after surgery is another fantastic benefit of IV therapy as well. And overall, improving the quality of life. I can tell you in my practice, most of our oncology patients, you would never even know they were oncology patients because they're doing that well. Most of them do not lose their hair. Most of them have minimal gastrointestinal side effects. And most of them, even though they have a little bit of fatigue, they're still able to carry on with their day-to-day life, which is important. So these are some of the common IVs we offer at my clinic for our oncology patients. I'm sure most of you are familiar with high-dose vitamin C. We also use oxidative therapies such as ozone, DCA, which is dichloroacetate, poly-MVA, artesunate, also known as artemisinin, salicinium, DMSO. We do vitamin and mineral cocktails at various times. Rehydration IVs are important, especially when going through chemo and radiation. Amino acids and glutathione. These are just a few that we do. So, as you can see, vitamin C is not alternative anymore. It is now mainstream. Hey, it says that on MD Anderson's website here. Vitamin C can actually make the cancer treatment more effective. So all those years of alternative doctors, NDs doing vitamin C therapy, now we can see that this is, real science and it has a real benefit for patients undergoing oncology therapies. So you might want to, show this to your oncologist, and there's plenty of other websites out there that you can go to get accurate, up-to-date research on the potential positive effects of vitamin C in conjunction with both chemo and radiation. Okay, so when someone's diagnosed, besides obviously investigating different options for what therapy is best for them, what can we do right away to help prepare this person for whatever they're going to go through, whether it be surgery or whether they're going to start on chemo or radiation ASAP? So when we think of surgery, we want to, again, mitigate those side effects of surgery, minimize the chance of them getting an infection, make sure they have optimal nutritional status to help heal that wound that's going to be incurred during the surgical process, and hydrating them as well. So these are some of the therapies we use. Ozone UVB combination is a fantastic therapy to help with any kind of infections, enhancing circulation, improving energy. Having that person hydrated before they go into surgery is important too, because a lot of times, after the surgery, they're not going to feel like eating or drinking as much as they should. And unfortunately, a side effect of surgery, because of the pain medications that are prescribed, is constipation. So if you're not drinking adequate amounts of fluid, the bowels are probably not going to be working as efficiently as they could. And then, of course, using nutrients to heal that wound back up. Mitochondrial support. Anybody who's had surgery, you don't feel as energetic or peppy as you were before you went into surgery. So your mitochondria, the energy-producing cells in every cell in our body, have taken a hit from the drugs they have given you, the anesthesia, the trauma from the surgery. We have therapies such as poly-MVA, again, nutritional therapies, glutathione to help with the oxidative stress the body has just gone through to support you after you've gone through that surgery. With radiation, we are pretty much focusing on hydrating that person. They can become very hydrated during radiation. Obviously, we're causing a burn to a certain area. The tissues become dehydrated. Radiation fatigue is also very real too. So we want to use therapies, nutritional therapies, B vitamins, minerals to help that person's mitochondria. And again, seeing that our vitamin C can enhance the effects of the radiation on the targeted cells and protect the surrounding cells so they are not damaged from the radiation. We typically don't use glutathione during radiation, but as a recovery support system after radiation. Glutathione can be taken orally, but obviously this topic is focused on IV therapies. In IV therapies, we can get much higher doses of glutathione in a short period of time. Okay. During chemo, the main therapies we want to consider, again, are keeping the person hydrated, using adjunctive oxidative therapies, whether it be ozone, vitamin C with our artesunate with ozone combined together to help enhance the effects of the chemo on the targeted cells and protect our own cells. You can actually have, a vitamin C or oxidative therapy the day you are going in for chemo or radiation, although we do find in my clinic it's a little bit much for patients on the same day. So as close to their therapy as possible, we try to get those IVs and then those oxidative IVs. Even a hydration IV the day of the therapy is appropriate and will make the person feel better and have them less nausea overall. Again, going through chemo, the mitochondria, the energy-producing cells in every cell in our body are kind of given a hit. So the patients have, very real fatigue that can last for many, many months. So therapies like a combination of DCA and poly-MVA come into play and work very well. There's other therapies besides chemo, radiation, and surgery that are the targeted biologics or bone marrow transplants, or say someone decides not to do any traditional therapies. What can we do from them at that point? And again, you see some overlap with the therapies I already talked about. Again, supporting the mitochondria, causing oxidative effects, free radical damage to the cancer cells, while protecting our own cells. Other therapies that have not been touched on that we offer at our clinic are mistletoe, both intravenously as well as subcutaneously, salicynum, and DMSO. And if you have particular questions on any of those, I'd be happy to answer them after the talk here. Okay, so you've gone through therapy, hopefully with minimal side effects. Hopefully your doctor says you are in remission, cancer-free as far as they can tell. What should you do at this point? Should you say, woohoo, I'm good, I don't need to do anything more, I'm gonna go back to my regular lifestyle? No. I mean, for me personally, I mean, I think that person should be, on guard the rest of their life in some way, shape, or form. It doesn't mean every week they have to come in for the rest of their life and get an IV, but certainly during the first, 6 months to a year, maybe even 2 years of some cancers, you want to be, doing as many therapies as possible to make sure that cancer does not come back. In some cases, the cancer has progressed, so what now? Chemotherapy, even though it targets certain cells, it leaves other cells still there in the background waiting to kind of take advantage of the situation when the time is right, which is why a lot of people have reoccurrences. And unfortunately, at some points, standard allopathic care has nothing else to offer the patient. So what can we do for them at that point? So after traditional therapies are completed, we typically recommend somebody come in anywhere from 1 to 2 times a week for a total of 3 to 6 months, okay? And what we do with them at that point, based on the chemo agent they've received, the radiation treatment or whatever, we sit down with them, we have them on a good oral supplement program, obviously dietary and lifestyle changes, and we want to maintain, them being in a cancer-free state. If somebody, again, has not done favorably with their initial treatments, we'll want to be maybe more aggressive. And there are some therapies we can do 5 days a week if the person's able to. So we usually look at a part of a comprehensive treatment plan when we review the whole patient, and we want to make sure that this is a lifelong thing they should be actively monitoring, make sure they don't have any cancer reoccurrence, and do the best they can to prevent that from coming back. So this is just a couple recent stories we have in my clinic. We see a lot of women with breast cancer because we do offer infrared mammography at our clinic. So a lot of women find us for that. I've had a 45-year-old female. She was diagnosed with stage 2B breast cancer. She underwent conventional treatments along with some supportive IV therapies, mainly vitamin C or artesunate with vitamin C. And to this day, she is cancer-free. She was a high-level music executive, Energizer Bunny lady, continued to work throughout her entire treatment. I was amazed at how well she did. She didn't lose her hair, she still worked, she still had all that energy, and she's still going to this day and cancer-free. We have another lady right now that's just finished up her therapy in our practice, 52-year-old female. She was diagnosed with stage 3A breast cancer. Sorry, I forgot to write breast cancer there. She did undergo conventional therapy, surgery, radiation, and chemo, and she just completed her last round of chemo. She did experience some minor side effects during that time, loss of hair, loss of appetite, but much less than all her friends did. When these patients go to get their treatments, they're seeing other patients around them, and they're comparing themselves to them, and she said to me, wow, everyone around me does not look too good, and they all ask me, what am I doing? And she tells them, I'm using, conventional therapies along with, traditional naturopathic therapies and IV therapies, and I'm doing much better. So it's still, obviously, too early to tell how she'll do long term, but, I think she's going to do very well. She's doing all the things that we told her to do, and she's had minimal side effects. And for her, it's important, she has a 3-year-old. She wanted to be able to get through this and be able to see her 3-year-old graduate from college one day, have grandkids, and certainly keeping up with a 3-year-old, as any of you know, is very exhausting. And she's very happy that she was able to do that. Okay, thank you for your time. If you have any questions, I guess now is the time to ask them. I appreciate you having me at this conference this weekend, and I'll do my best to, again, to answer any questions you might have. Hi. I can barely...